conduction or bone conduction? In normal ears, air conduction will be better or bone conduction? Yes, very good. Air conduction will be better. Why air conduction will be better? Yes, the common pathway is sensorineural pathway for both. In air conduction, we also have the conductive pathway. And the most important part of conductive pathway is the middle ear. Why do I say this is the most important? Because here, the transformer action is taking place. The amplification of sound is taking place, because of which more sound is going to the inner ear than the sound that directly goes to the inner ear. So normally, air conduction is always better than bone conduction in normal ears. Is that clear? Yes. So what are the tuning fork tests that we commonly use? Yes, the Rinne's and Weber's. What we do in Rinne's is, we test the air conduction, and then we test the bone conduction and we compare the two. Now, if the air conduction is better than bone conduction, we call it as Rinne's positive. Rinne's will be positive in two conditions. One you tell me, one I will tell you. Rinne's is positive, means air conduction is better than bone conduction. Yes, in normal. I just told you why in normal. Yes, because more of sound is going into the inner ear. Now, why in sensorineural hearing loss also Rinne's is positive? Now, in sensorineural hearing loss, will the air conduction go down? Sensorineural hearing loss. Will the air conduction go down? Yes. Will the bone conduction go down? Yes. Which will still be better? Yes, air conduction. Why? Because more of sound is going to the defective inner ear because of amplification in the middle ear, rather than the sound that is directly going to the defective inner ear. So Rinne's is positive, means air conduction is better than bone conduction. Rinne's is positive in two conditions. You cannot afford to forget this. Which two conditions? Normal and sensorineural hearing loss. Now, when the bone conduction is better than air conduction, we call it as Rinne's negative. So Rinne's will be negative in which condition? Bone conduction is good. What is bone conduction? Bone conduction means sensorineural pathway. So if the sensorineural pathway is good, where is the defect? Conductive pathway. So Rinne's is negative in conductive hearing loss. Now Rinne's is also negative in unilateral severe sensorineural hearing loss. Now what's the meaning of severe sensorineural hearing loss? Severe sensorineural hearing loss means hearing loss more than 70 decibel. Now if there is such a severe hearing loss in 1 year, do you think this patient will hear the air conduction or the bone conduction of this tuning fork? No, he will not hear neither air conduction nor bone conduction through this ear. But when we are testing the bone conduction, because of bone conduction, the skull vibrates, the opposite cochlea also gets stimulated. So there is transcranial transmission of sound. So the normal ear or the better ear senses the sound, and the patient says that I'm hearing when I'm testing the bone conduction. Is this the true result? No, this is not true result. He is not hearing anything from this ear. He is telling me I'm hearing the bone conduction and not hearing the air conduction. He is hearing the bone conduction. Why? Because he is hearing it from the other ear. So this is a false result. This is false negative. Yes, so Rinne's is negative in two conditions. You have to remember, in conductive hearing loss and in unilateral severe sensorineural hearing loss, where it is false negative. Now, why do I specify unilateral severe sensorineural hearing loss? What will happen if there is bilateral severe sensorineural hearing loss? If both the cochlea is gone, will the patient hear anything in any ear? No, he will not hear. Yes, for the Rinne's to be falsely negative also, for the patient to perceive the sound when I'm testing this ear from the other ear at least has to be normal. So Rinne's is negative in two conditions. Which two conditions? In conductive hearing loss and in unilateral severe sensorineural hearing loss. Is that clear? Now here is this patient who has a Rinne's negative. Yes, Rinne's is negative means either conductive or a severe sensorineural hearing loss. And severe sensorineural hearing loss is an emergency. It has to be managed immediately. How do we differentiate whether it is a conductive hearing loss or a severe sensorineural hearing loss, or whether it is a conductive or a sensorineural hearing loss? Do we have any test for that? Yes, Weber's. Now what is Weber's? The mnemonic of Weber's is SOCS, SOCS. In sensorineural hearing loss, Weber's is lateralized to the opposite side, whereas in conductive hearing loss, Weber's is lateralized to the same side. Now, what is this? By Weber's, what you're doing is vibrating the tuning fork and we are placing it over the forehead or over the vertex or over the teeth. And what we are seeing is lateralization of sound, in which ear the sound is being heard as louder. Now, you will first tell me, when I'm testing the Weber's, what am I testing, the air conduction or bone conduction? Yes, I'm testing the bone conduction. So, suppose in my right ear, the bone conduction is defective. This sound is going through the bone conduction of both the ears. Yes, in my right ear, the bone conduction is defective. So this sound will be heard better in which ear? This sound which is going to the bone conduction will be heard better in my left ear. Yes, so whenever there is a sensorineural hearing loss in one ear, the Weber sound will be lateralized to the better ear or to the opposite ear. Whereas, if there is a conductive hearing loss of one ear, suppose in my right ear there is a conductive hearing loss. Now, Weber's will be lateralized to which ear? To the right ear. Yes, to the worst ear. To the same side. Why? Yes, because when I'm testing the Weber's, this sound is going through the sensorineural pathway of both the ears. Now, in my right ear, there is conductive block. So, external sound is not going to go inside and interfere with the sound that is going through the sensorineural pathway of this ear. Yes? So, there is no interference to the sensorineural path, to the sound that is going through the sensorineural pathway in this ear. Whereas, in my normal ear, because it is normal, the external sound is going inside, the ambient sound is going inside, and it is interfering with the sound which is going through the sensorineural pathway in this ear. So, when I'm testing Weber's, in this ear, which has conductive block, no interference. In this ear, there is interference. So sound will be heard better in the worst ear, in the ear which has a conductive block towards the same side as the defect. Is that clear? Yes. So if the Weber's is to the right, then what is the DD? Yes, so everywhere you have to remember just two things. Rinne is positive in two conditions, normal and sensorineural hearing loss. Rinne is negative in two conditions, in conductive hearing loss and in severe sensorineural hearing loss, unilateral. If Weber's is towards one side, suppose towards the right, Weber's is towards the right. What is your DD? Yes, means this is the worst ear of conductive hearing loss, or this is the better ear, means there is left sensorineural hearing loss. Yes, so it can be either a right conductive hearing loss or a left sensorineural hearing loss. There can be only this two DD. Yes, so now you tell me if the Weber's is towards the left, what is your DD? Weber's is towards the left, so it can be either a left conductive hearing loss or it can be a right sensorineural hearing loss.